and your pelvic floor has just gone through absolute torture.
Yeah.
And even just like breathing is so important when you're doing, even just picking up your baby. If you're not focusing on your breath, you're actually increasing your pressure. Like when we hold breath, right? You're going to increase your pressure, and your pelvic floor has just gone through absolute torture.
Yeah.
So if you're holding your breath, you're putting a lot of pressure on that. You can like increase your risk of having a pelvic organ prolapse. So there's different things like that, because our pelvic floor, it's just this hammock of like a sheet of muscle, right? And all of our organs sit on top of that.
On this sheet of muscle. You're just like, great.
Right? It's kind of a little muscle that happens to hold everything, and also held baby on there for quite a while too. And if you had a vaginal birth, like baby just blasted right through that.
Yeah. Just like bam, coming out. Yeah.
And if you had a C-section, it actually does less damage to the pelvic floor, but you have other things you need to rehab too. And it doesn't mean that it didn't take a toll on your pelvic floor at all, because the pressure of the baby was still there for that period of time. But you do see like typically vaginal birth has more issues in the pelvic floor muscles, but those muscles, like we need them to hold the organs up. And if those muscles are dysfunctional, then we start to see problems